Hi, I'm Dr. Suvarchala. I'm the Scientific Director with Ziva Fertility Centers. Often when we perform an IVF cycle, patients ask us how they can improve their success rate. What is it that they can do? Definitely there are a few things you can do personally. You can keep your weight under control. You can have a proper BMI according to your height and weight and your age. You can definitely have other factors under control, like if you have diabetes or sugar or thyroid or prolactin. All those things will be helped by us, and also it has to be followed by you for you to be able to enhance your chance of success. You can also have a proper diet. Now undernourished or overnourished is also not good. Obese patients have also known to throw poor quality eggs. So all these things are under your control. So if you are able to do what is under your control, the rest is left up to technology, the technology of IVF. I'll share with you a few tips on how you can choose technology to also enhance the things that you've already done. So a proper lifestyle, a proper diet, a proper physiology, a proper mental state of mind, and combined with technology, your success rate increases tenfold. Now let's look at what are the technological advances in increasing your chance of success. One is having a frozen embryo transfer. While I say this, it is not recommended or necessary for everybody. A frozen embryo transfer means that your embryos are not transferred in the same cycle that your eggs were got out. So your injections were given, then your eggs are collected, and as the embryos are being cultured inside the lab, your endometrium is being prepared. They're all on the same day and stage, and we transferred the embryos back into your endometrium. So that's the procedure. It's called a fresh embryo transfer, where we transfer in the same cycle. It is recommended, and a lot of studies statistically have said that sometimes these medications cause a mismatch between the endometrium and the embryo. Either they are over receptive or under receptive. If there is a thin endometrium, it means that it's not ready, or it's not the right size with proper blood supply for the embryo to come into the uterus. So that's when there is a mismatch in all this happening, it's better to go for a frozen embryo transfer. So you can increase your chance of success by going for a frozen embryo transfer, especially when it is recommended by your fertility specialist. They would have measured the endometrial thickness, they would have performed something called as receptivity of the endometrium, and that's when they come to a conclusion that you're not ready for a transfer of embryos in this cycle in which your eggs were got out. So please pay attention to them. When they ask you not to do it, don't do it. There is also a small complication with OHSS, when your ovaries bombarded and they gave us a lot of eggs, and that's when you might get pregnant, but there are other complications too that could lead to complications during pregnancy when you are suffering from OHSS and you get pregnant. So it's better to go for a frozen embryo transfer, and there is a higher chance of success, certainly when such causes are glaring at us. So it's very important to follow your fertility specialist advice. There is another beautiful technology called the preimplantation genetic testing, which would increase your chance of success. Now what is this and why is it performed? This technology works very well, especially for people who had previous failures, are of advanced maternal age. The husband has severe sperm abnormalities, he has a high DNA fragmentation problem inside the head of the sperm, which could lead to poor quality embryos, or an embryo which is not implanting at all. All these factors are causatives of previous failures or not being able to get pregnant. Now PGT, preimplantation genetic testing, is taking a piece out of the embryo, doing a genetical analysis on piece which is indicative that the embryo could be normal or abnormal. So what is done is all the chromosomes are studied. All the chromosomes are looked for abnormalities. Is there duplication? Is there deletion? All those things are looked at, and then the report is given out that embryo number 1, embryo number 4 or 5 abnormal, embryo 6, 7, 8 normal. So the abnormals are discarded, and the normal chromosomal, the ones which have proper chromosomal competency, are put back into the endometrium. So this is another very important and a beautiful technology where the success rate can be increased by 20% in especially previous failures or advanced maternal age. So, PGT, preimplantation genetic testing, is what you should be talking about, and a frozen embryo transfer, especially when you are not eligible and your endometrium has crossed the window of implantation. Please feel free to call us and talk to us more about these two technologies. We will have more discussions and give you more information. Thank you so much.